Hello everyone, I'm Dr. Rohan Khandelwal. I'm a breast cancer surgeon and I head the Department of Breast Diseases and Cancer Care at CK Birla Hospital, Gurgaon. In today's video, we'll be talking about lymphedema. Lymphedema is a problem where the arm swells up and this can happen after breast surgery. So all patients don't land up with lymphedema. The incidence of lymphedema varies from 5 to 10% in various studies. And it also depends on what kind of surgery has been done. Earlier, the incidence of lymphedema was quite high when all patients required lymph node dissection. But ever since sentinel lymph node biopsy has been started, the incidence of lymphedema has further come down. If you've been diagnosed with breast cancer, I would strongly recommend that you talk to your surgical oncologist or your breast cancer surgeon whether you are eligible for sentinel lymph node biopsy or not. If a lymph node clearance has been done, then the risk of lymphedema, as I've told you, varies from 5 to 10%. And there are certain precautions which we tell all our patients so that they can reduce their chances of developing this dreadful condition. First and foremost are the exercises for the arm, because the lymphedema is going to involve the arm. And this lymphedema, you should understand, is occurring because the lymphatic drainage for the arm and the breast is the same. And once we remove those lymph nodes, this fluid can accumulate in the arm and can give rise to swelling. So these exercises, we tell these patients to do these exercises from the very next day of the surgery. And I have Ms. Supinder here, who's a very dedicated chemo and breast cancer nurse, and she'll be demonstrating what are the exercises which we recommend. So the first thing which we tell these patients is that these exercises have to be done lifelong. And if lymphedema develops, then the frequency of these exercises have to increase even further. So the first exercise which we recommend is lifting the arms. And the arms have to be lifted up till shoulder level, and the patient has to hold them there for 5 to 10 seconds. Then this is followed by an overhead abduction of the arms, where arms are lifted above the head. Again, they have to hold them in place for 5 to 10 seconds. After this, arms on the side. We tell the patient to keep the arms on the side and hold them. And finally, arms at the back. So you turn back and arms have to be taken in the back. So this is counted as one set, and we tell the patient to do at least 15 to 20 sets in one day. So they can split it into sets of 5 each, and they can do it 3 or 4 times a day. In addition to this, whichever hand has been operated, we tell the patient to stand next to the wall and take that arm gradually up. So stand next to the wall and take that arm gradually up. This also helps in the movement of the arm and also facilitates the movement of lymph. In addition to this, we also tell the patient to do the elbow wing exercise. So we tell the patient to keep their hands at the back of their head and to flap them like wings, right? And this also needs to be done at least 50 to 100 times a day. In addition to this, we give all our patients an exercise ball, and this exercise ball also helps in the movement of lymph. And this exercise ball, we tell them that whenever they're sitting idle, they need to press it at least 400 to 500 times a day. So these are the various exercises which we recommend to our patients who've undergone breast surgery, whether it is mastectomy or breast conservation surgery. In addition to this, there are some very important pointers which we tell our patients. Number one, whichever side has been operated, they should not get any injection on that side. They should not give blood for sampling from this arm, and no blood pressure measurement is to be done from this arm. Right? These precautions have to be taken care of, because if there is any sort of trauma or infection, that can precipitate lymphedema. Also, what you need to remember, that if the patients are taking a very long flight, although studies have shown that long flights don't affect or don't precipitate lymphedema, but what we recommend is that if they are taking a flight more than 2 hours, they should wear an arm stocking. And even if lymphedema is developing, the initial treatment what we recommend is These exercises plus we recommend the arm stocking to be worn regularly. Also, we tell our patients that if they get cut on the hand while working, they should immediately tell us so that we can provide adequate antibiotic cover for that. Otherwise, that can also precipitate lymphedema. So by taking these simple precautions and by doing these exercises, one can reduce the risk of getting lymphedema. If lymphedema develops, you should continue doing your exercises, wear an arm stocking, and if it goes really out of control, there are other lymphedema exercises and lymphedema massages which are available, which can help you out. I hope you found the video useful. If you did, please do press the like button, drop us a comment if you have a question, and please do subscribe to our YouTube channel. Thank you.